Hi everybody, it's Lee and Bridget here from King Harvest and kingharvest.org, and today we're going to talk about the most common question and a group of questions we get asked about, and that is just pain. So let's hear a little bit about what we have.
Okay, so the first question is, how can cannabis help with pain?
Alright, so that happens in a number of different ways. You can inhale it for instant relief, you can take it by drop form, it'll go through the liver for longer lasting relief. We can use it in topical form, right, for location specific relief. And there basically is, for every type of malady and ailment, there's another way to medicate safely and reliably that can get you the reliable symptom relief that you need without causing a lot of negative side effects, meaning like you don't have to get super high to get the relief that you need. So sativas will help with depression and pain, indicas will help with the deeper pain, CBD will help with inflammation related pain, and so depending on the type of pain you have and what's going on with you, we'll prescribe different types of THC and CBD.
Okay, so the next question is, what is the best method to ingest cannabis for pain?
Okay, so in the case of chronic pain, the best method in our experience is to deal with it in drop form and to take it through the mouth and through the liver. If one takes cannabis oil by mouth through the liver, it's going to process. It takes an hour for it to hit you, but the relief will last for 4 to 6 hours, even 8 hours in many cases. If somebody inhales cannabis or like uses vape or a vaporizer system, you're going to get instant relief from taking it subcutaneously because it goes right through the blood-brain barrier, right? But it's only going to last you for 30, 40 minutes, maybe 60, maybe 90 minutes if you're super sensitive.
Right.
So for chronic pain, we suggest that you take drops, right? Because it's going to give you longer relief, longer lasting relief that's going to be more meaningful, frankly.
Absolutely. Okay, so what is the best method of ingesting cannabis for sudden pain?
So sudden pain I would think of as being acute pain, like an injury, like everything from slamming your hand in a door to cutting your finger with a knife. And so in that case, that sudden acute pain, things that I would use Tylenol for, right? For that, we would use THC. We would use, in my opinion, in my case, in your case, we would use indica THC. It's going to calm the patient down. You can put the drops right under the tongue, and if somebody has an injury and has just injured themselves, like immediately needing relief, you can even medicate them that way.
Okay, so what is the best method for burns, rashes, or skin pain?
That would be topical.
Right.
Topical is going to create a lot of relief by knocking down the inflammation, and it's also going to create a lot of ease and soothe the injury point and even prevent the injury from really manifesting and taking place. If you've ever burned yourself and then put yourself right on an ice cube or that kind of thing, it'll stop the injury process, and it'll actually immediately start knocking down the inflammation, which lessens the injury.
Right.
So for burn, rashes, skin pain, you would want to use a topical, and topicals will come in. King Harvest makes a wonderful, the most exciting thing we've made recently is the Blue Emu line of products. Blue Emu comes in a dropper bottle for topical use, but there are also patches, transdermal patches, where we can put large doses of full extract medicine right on the skin. And even time release it over the day, where it really lasts a full 12 hours.
Right.
Much better than pharmaceuticals.
Absolutely. Okay, so the last question is, can I use cannabis for pain without getting high?
Absolutely, you can. King Harvest, we here at kingharvest.org, we believe in microdosing, and so we're going to give you either a 0.5 milligram or 1 milligram per dose, depending on what you need for your symptoms and your disorder. But all of our patients are terrified of getting high. Many of them are 66 years old. Many of them are 6 years old, and so it's our responsibility to microdose and to do it safely under full supervision so that people will get the relief that they need without having to be cognitively high. Properly made cannabis oil and proper ingestion, safe ingestion of cannabis oil will make it so a patient will get emotional lift without cognitive impairment.
Right.
And so what we want to do is replace all of the pharmaceuticals and all these fake plastic meds that these companies are pushing all day long. We want to replace those with cannabis oils, cannabinoids, and give you the healthy relief that you need. It can be done safely. You don't have to get high to actually, like, you specifically do not have to get high to get the relief that you need. I'm Lee. This is Bridget. We're here at King Harvest and kingharvest.org. Please give us a call if we think we can help. 877-469-4584. We are happy to help. Happy healing.
Happy healing.
Hi everyone, this is Lee from King Harvest and kingharvest.org. I wanted to take a moment and thank you all for watching. If you like this video, please go ahead and subscribe or click on one of the videos to your right. Further, if you have any questions or comments, go ahead and leave them below. You can also visit us at kingharvest.org. Thank you again and happy healing.